If you suffer a herniated disc, whether it's in your neck or in your back, but you really want to avoid surgery, could a regenerative orthopedic treatment help you avoid that surgery? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. As always, with any of my videos, this is not meant for medical advice. This is meant for general information and educational purposes only. I cannot give specific medical advice on this video or anywhere on social media, so just understand I am not giving you advice here, especially when we're talking about regenerative treatments. I'm not promoting them. I'm not telling you should do them. I'm just putting this out for information. When you're talking about experimental treatments, at least as pertains with the FDA, I want to make that very clear that I just am putting this out there so you better understand what would be involved. But this is a very quickly evolving area in orthopedics and in spine surgery and spine care, and that's regenerative treatments for herniated discs. I literally had a patient earlier this week who another doctor in town had done PRP for a herniated disc and the radiculopathy or the sciatica with that, and she had good success with it. So this is something we are seeing more and more. And if you've ever dealt with the pain radiating down an arm or radiating down the leg, the numbness, the tingling, the weakness that can come from the herniated disc and the radiculopathy, or what those symptoms are called, with that herniated disc, you know how difficult it can be. Herniated disc, if you're not really aware of it, think of the disc between the bones, the vertebral bodies in your neck or back. Think of the discs as sort of the jelly donut, where the inner jelly pushes through the outer lining of the donut or the disc, and then it puts pressure on a nerve root and causes symptoms down the arm, down the leg, numbness, tingling, weakness, things like that. This is very common. It affects millions of people across the world. Typically, it occurs more often as you get older or after injury. Sometimes it can be the result of some degenerative wear and tear conditions, but it is very common. Now, initially, most doctors, most surgeons treat herniated discs with non-surgical treatments. That can be rest, that can be physical therapy, anti-inflammatory medications. If that doesn't work, then you typically look at things like epidural steroid injections. None of that works. The symptoms are still there. A lot of times you're talking about a surgery, a microdiscectomy, to go in, take out the part of the disc material that's pressing on the nerve to relieve the symptoms. And that can be effective, but surgery has risks. It's invasive, and sometimes it doesn't work. And so we're always looking at ways to try to prevent surgery. And that's where, honestly, regenerative treatments might come in. The idea is harness the body's natural healing processes to repair the disc rather than just masking or treating the symptoms, which is typically what an epidural steroid injection is. And the two most kind of commonly used regenerative treatments as it pertains to herniated discs are platelet-rich plasma, or PRP, like I mentioned earlier, and stem cell therapy. Stem cells basically involves typically harvesting what we call mesenchymal stem cells, usually from your bone marrow, sometimes from fat or adipose tissue, and injecting that directly into the disc area. And then these differentiate into disc-like cells, but they also reduce inflammation, which is part of the reason that they're thought to help here. Early studies at least show that they may slow the further degeneration of that disc, but more importantly, alleviate pain and improve function. And for some people, that might help avoid surgeries. The studies are early. The early clinical outcomes, the early clinical trials do show better outcomes. Can't talk today for some reason, and they might be better than placebo. PRP's probably been used a fair amount longer. That's where we draw blood. That blood, we take the syringe, put it in a centrifuge, spin off the red blood cells. What's left are very concentrated platelets, growth factors, inject that into the disc in the area around that nerve root, trying to reduce inflammation, trying to heal the disc with boosting collagen production. And it looks like the studies out there show that it does have good effects for discogenic low back pain. How long it lasts is up for debate, but some show that it can last months, maybe even a year after just one or a few treatments. So the potential benefits are very good. Potentially avoid surgery, reduce pain, improve function. Whether that's long-term benefit or if it's going to come back at a certain point, we don't really know. But if you can potentially avoid a surgery, that's not necessarily a bad thing. The side effects are typically minimal. Injection site soreness, things like that. Infection anytime you do an injection of anything is always a potential risk, not at all very common. Again, these are not typically treatments that are FDA approved, so you're going to be paying out of pocket as insurance won't pay them. And we need more research. We need longer term studies, larger studies against placebos to see where this shakes out. But as somebody who's treated numerous patients with back pain, I think the potential benefits of regenerative treatments are great, but it might not necessarily be right for you. Talk to your spine doctor or spine surgeon and learn your options. See if that is an option to potentially help surgery. But just remember, again, this is not specific medical advice for all the reasons I just mentioned. Now, I've written an entire ebook on a variety of regenerative options and even non-regenerative options for osteoarthritis, but for all kinds of orthopedic treatments. You can get that free by clicking the link in the description below. It's called the Arthritis Solution, but it pertains to all different kinds of orthopedic conditions. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, you can click that same link in the description under this video, fill out the contact form, and learn more about scheduling an appointment to see me. I'd also love to hear your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question there, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.